Welcome to Splendor Gardens, Mowe, Ogun State, a serviced estate, fenced and gated, with paved roads and streets, 24-hour surveillance and security, and standard recreational facilities. Our strategically planned lots are for all classes of people, from the upper class to the young and upwardly mobile. Available lot sizes are 160 square meters, 220 square meters, 300 square meters, and 600 square meters. For more inquiries, please visit our website www.visgloterproperties.com or call those numbers on the screen. At Splendor Gardens, quality bingos with affordability, beauty, and serenity.
Hello, you're welcome. My name is Dr. Chris Williams. Today we are looking at something that it's common, not very common though, but it's so vitally important because when it does happen, it can result in some very grave consequences, and that is also preventable. Today we are talking about diabetic foot ulcer. Diabetic foot ulcer. Okay, diabetic foot ulcer is a chronic unhealing wound or ulcer in the feet or in the foot of a diabetic. When a diabetic, somebody who is an established diabetic, has a chronic unhealing wound, the wound is there several weeks, several months, sometimes several years, and every other thing they do in order to get it healed, it continues to fester. Wound starts as a joke, but with time it becomes like a gully, and then it's just unhealing. Okay, so diabetic wound can occur in several other parts of the body. It can occur on the forehead, it can occur on the scalp, it can occur at the hands, it can occur in the hips area, okay? But then the one that occurs in the feet or in the foot are the most common, okay? So there is a difficult to heal or an unhealing wound in the feet of a person who is diabetic, occasioned by several things. Now, what are the causes? Number one, there is chronic hyperglycemia. That's long-standing, uncontrolled high blood sugar. Long-standing, uncontrolled high blood sugar. It can lead to a diabetic foot. It can lead to a diabetic foot. Okay, I'm sure as we talk, you will be seeing some of the pictures, and then you will understand what I'm talking about. So there's chronic hyperglycemia, long-standing uncontrolled diabetes. That's one of the foundational cause. It's important to say that chronic ulcers or chronic wounds can occur in some other diseases. Okay, sickle cell disease. Somebody can develop chronic unhealing wounds. Also, gas gangrene can be a source or a cause of chronic unhealing wounds. A chronic unhealing wound can be due to cancer, and then it can also be due to Buruli ulcer or maybe a TB of the skin or something. But the one we're talking about today is the one caused by high blood sugar, chronic high blood sugar in the body. Okay, so a second cause of chronic unhealing wound in diabetics is that the chronic high blood sugar leads to atherosclerosis. Atherosclerosis, there is a thickening of the small arteries that supply the extremities. A thickening of the small arteries that supply the extremities. What happens is that as plenty of sugar or glucose is streaming around in the blood, it begins to be stored away as plaques in the inside of arteries. So with time, there's a thickening of those arteries. Also with time, there's a reduction of the lumen such that enough blood is no longer getting to the extremities. So it's formation of plaques on the inside of the arteries can lead to thickening of the arteries. So they become less effective in circulation. So there's poor circulation problem, and then it can also lead to reducing of the hollow or the lumen of those blood vessels. These two, the thickening and the reduction of the lumen, would lead to insufficient blood supply, insufficient nutrient supply to the extremities, and this eventually can lead to wound that is unhealing. So the thickening of the blood vessels, plaque formation within the blood vessels, and leading to poor circulation and poor supply of nutrients will lead to these wounds. Also, there's another cause is peripheral neuropathy or peripheral nerve damage. Okay, so the nerves, the blood sugar, plenty of blood sugar swimming around, begins to react with the proteins. And nerves are made out of proteins. Muscles are made from proteins. Tendons are made from proteins. These things, the blood sugar begins to react with them in what we call glycation, and then non-enzymatic glycation. And then this will lead to damage of those nerves, damage of those tendons, and then sometimes damage of those muscles. So when it leads to damage of the nerves, we call it peripheral neuropathy, and the symptoms are numbness. The person begins to feel numbness. They begin to feel tingling sensations. They begin to feel peppery sensations in the extremities. Okay, and then they can also begin to they no longer can sweat in those areas. Anhidrosis, they no longer can sweat in those areas. All these together lead to loss of sensation and sensitivity in the extremities. So this person can match a nail and not know, because they've lost sensation and feeling in that area. They can hit their leg against a table and they will not know. Their leg can be on something that is piercing. They will not know. Their leg can be on something that is too hot for comfort, and they can't know. So they will be having a lot of wounds. Okay, so there is increased occurrence, accidental formation of wounds, and then there's also solo, de novo, just the skin will just break down by reason of of all these reactions that we're talking about, particularly because of poor blood supply. Okay, so another thing is that the glycation to the muscles will lose to the person can't coordinate the movement of their feet any longer. It takes some intelligence to to be moving around the house and not be hitting one's leg against the chairs and the tables. But sometimes in the diabetic, because they have lost the coordination of those nerves and tendons, they'll just be hitting their legs anyhow, and they'll be having increased number of wounds. Also, poor foot care. Diabetics are supposed to know how to take care of their foot, because their foot is a major target where complications can come into the disease. But when a diabetic does not know about how to take care of their foot, it can lead to diabetic ulcer. Okay, so poorly controlled blood sugar, it can lead to diabetic ulcer. Pardon me. All right, so these are the causes. So there's poorly controlled blood sugar as well. We've talked about it. Junk eating, taking of alcohol, cigarette smoking, drugs addiction. Alcohol addiction, cigarette addiction, drugs addiction, these lead to they are also routes through. These are routes that also lead to atherosclerosis themselves. They lead to thickening of the of the blood vessels. Drugs, consumption, excessive consumption of alcohol, excessive consumption of drugs, and of caffeine also, and drugs lead to the thickening of the arteries, which we have referred to as peripheral, which is referred to, as peripheral blood vascular disease. Peripheral vascular disease, it leads to plaque formation, it leads to thickening of the blood vessels, and then it leads, like we said earlier, to formation of diabetic wounds. Also, so we talked about poor food care. If a diabetic does not know how to take care of their food, maybe they wear too tight shoes or too tight socks, too tight shoes or too tight socks, it can lead to a wound. They will just wake up one morning and see that they have had a bruise, and then from bruise the wound will start spreading. So too tight pressure or too much pressure on the feet, either from their foot or from their socks or anything they are wearing in their legs, can lead to it. Also, you see some women's shoes, some women's legs, they have plenty of calluses from tight feet, tight shoes that they wear. So if that happens in a diabetic, calluses and fissures can also lead to diabetic wounds. All right, so I will take a break. When we come back, we'll try and talk about the grades of diabetic wounds, and then we'll provide solutions. Please do not go away. I'll be right back.
Welcome to Splendor Gardens, Mowe, Ogun State. A serviced estate, fenced and gated, with paved roads and streets, 24-hour surveillance and security, and standard recreational facilities. Our strategically planned lots are for all classes of people, from the upper class to the young and upwardly mobile. Available lot sizes are 160 square meters, 220 square meters, 300 square meters, and 600 square meters. For more inquiries, please visit our website www.visgloterproperties.com or call those numbers on the screen. At Splendor Gardens, quality bingos with affordability, beauty, and serenity.
All right, you are welcome back. It's family health, and today we are discussing diabetic foot ulcer. We left off talking about the causes of diabetic foot ulcer: peripheral neuropathy, peripheral vascular disease, okay, poor food care, the poor sugar control in the first place, and then poor attention to wounds. If a diabetic has a wound in the body, they should be very up and doing about the wound, because the wound of the body of the diabetic is not the same as every other person's bodies. Okay, so we have talked about the areas that wounds can affect in a diabetic: the feet, the hips, the shoulders, the fingers, the buttocks, the foreheads, the scalp. But this time around, we are paying specific attention to the wound in the feet. Okay, so gradings. There are 5 grades. There are 5 grades of a diabetic foot. First of all, the wound that is just eroding, that is just affecting the skin, the epidermis and the dermis. Okay, the skin alone. The grade 2 is the wound has become deep enough to affect the underlying tissues, that's the muscles and the tendons. Grade 3 is that the wound has developed an abscess, or it has formed pus. Okay, and usually it's a staphylococcus infection that causes that. And then the fourth grade is that a gangrene has set in. So there is dying of some cells, of some skin tissues. In some people, even one toe has died off completely. It has become lifeless. Some parts of the skin have become totally lifeless. And then stage 5 is when the whole feet has gone gangrenous. They have died. They have become lifeless. So grade 1, superficial ulcer. Grade 2, deep ulcer involving muscles and tendons. Grade 3, deep ulcer involving muscles and tendons, but with an abscess. Grade 4, gangrene of some tissues of the skin. And grade 5, the whole feet has been eaten up. How do you manage? Okay, proper blood sugar management. All right, like we have always said, the diabetic, and it's no gainsay, everybody knows the diabetic has to eat differently. Okay, he must stay away from sweet things and sugary things. He must stay away from heavy carbohydrates, hyperglycemic carbohydrates, eat low glycemic carbohydrates. Okay, we'll talk more about that. He must stay away from caffeines. He must stay away from alcohol, from junk foods, from stimulants, from alcohol. He must stay away from all that. Okay, and then he must watch the way he eats his food. Very important. So what are the things to embrace? Eat grains-based food, millet, guinea corn, oats. Make your swallows from grains. Okay, quinoa, flaxseed. Just go to town, make your swallow from grains. Also, stay away from food things, sweet things. We've talked about it. Eat things that are not sweet. Okay, very important. You can eat beans, you can eat cocoyam, you can eat potatoes. The non-sweet one, that's the Irish potato, and then a whole lot of vegetables, cucumber, cabbage, carrots. You can eat them. Okay, the eating pattern, the diabetic should eat only twice a day, around 10 a.m. and around 6 p.m. Must include a lot of fiber in his food. We have talked about making chaff from tiger nut chaff, coconut chaff, dry them and make your fiber from it, and then you are eating them. Eating a lot of vegetables, and if you want to snack on cucumber, cabbage, carrots, cashews, groundnuts if you like, but not too much. Also, exercising is so very important. Move your body. Make sure you are moving your feet. It's so very important. Exercising is very, very critical for everybody. How much more the diabetic? How much more the diabetic? The diabetic needs to be physically active as much as possible. Drink 3 liters of water daily. Make sure you alkalize your water with alkaline drop or with lemon. Okay, so next thing to do is care for your feet, and don't wear tight things, don't wear tight socks. Some people even encourage them to wear socks, but loose socks. Wear socks to protect their feet from being physically harmed by things around, but loose socks, not tight ones. Okay, when you go to do pedicure and manicure, let them not remove the nails to the edge till it becomes a wound. Very important. Exercising, I've talked about it. Okay, and then there's this vibrating machine. You will see the picture also. Vibrating and massaging machine where the diabetic and everybody who wants to really be healthy will put their feet, and then it will just jostle them up. This helps blood circulation back. You know, it helps blood circulation. If blood has been clogging or been damping around the feet, it helps to send the blood back. Okay, avoid wounds by all means. So very important. And if there is any wound, if you notice any wound, be very prompt and intentional with the treatment of your wounds. Get to the hospital immediately. Let hospital help you to manage it, and then let them teach you how to manage it and dress it at home also. Sterilize with sterilite gauze and Usol, okay, and then antibiotics powder. 3 things I would like you to note here. Things that in my practice I've used it to help a lot of diabetic people with wounds. Dropping alkaline solution in the wound helps it to heal better. Okay, so you can make your alkaline solution from alkaline drops. You can also make your alkaline solution by taking some teaspoon of sodium bicarbonate, put it in water, and then use it to dress the wound. And then after dressing the wound, put some drops around it. It helps it a whole lot. Also putting insulin. So what you do is you prepare a solution. After you have dressed it, you prepare a solution, put some insulin, put some sodium bicarbonate inside it. So that alkalized insulin solution, you put it in the wound, and then you use a sterilized gauze to cover it. It helps the wound to heal very fast. All right, so some other things to do. It's important. Supplements. A diabetic, in order to control his blood sugar very well. Listen, if the blood sugar is out of control, the wound will not heal. If the blood sugar is not out of control, the wound is not healed. If circulation is not enhanced, the wound will not heal. Okay, that's why you should do all the things I said. So the insulin in the solution, the sodium bicarbonate in solution, and then the vibrating machine. So very important. Some supplements that are useful, and you can call in to know where to get all this: Nitida, Venochantia, blood glucose tablets, alkaline drops, Calmax zinc, which is CMZ, very important. And then there's ALA, alpha lipoic acid, glutathione is also very helpful, and Silibom. And then, of course, the drugs that you have been given from the hospital, so very important. If you do all these things, you eat only twice a day, 10 a.m., 6 p.m. Daily, and then you hold your belly with some snacks, some healthy snacks, cucumber, cabbage, carrot, and all that, cashew during the day, garden eggs, okay? And then you exercise right, sleep right, eat right, the person will obviously be healthy, and you'll be able to overcome. These things I told you about: alkaline drop, about some drops of insulin in saline solution, and then also using the vibrating machine will help the wound to get healed. Will help the wound to get healed. All right, so very, very important. Thank you so very much for listening. Please follow us. Follow us on the social media. Follow us on the social media. Okay, follow us on Facebook. Follow us on YouTube, and then also on Instagram. All right, and if you are watching, you can, the number you are seeing, you can send us an SMS. Before now, I used to say people should send me a WhatsApp, but an SMS will be, or is better preferred right now because of certain things. Send me an SMS. Okay, if you send me, you try to contact me through other means, you may get me, you may not get me, but with an SMS, you're going to get me, and I'm going to revert. All right, and then if you need to be spoken to, I can call you, and then we will speak. Very, very important. We do training second week of every month. You can be in our training. It's a paid training. Also, you can copy. So when you get to YouTube, you should turn on your notification, and then also copy this link and send it to several other groups where you belong to. And if you need us to come and train in your organization or your church or your ministry, help us, just tell us on time. We'll be there. I train all over the country and even beyond, okay, beyond several places. Just this past week, I was in Ibadan, I was in Chagamu, I was in Ijebu-Ode, several other places like that. We've been to Port Harcourt, we've been to places. All right, so you can contact us. Don't forget our books, Make Your Food Your Medicine, is available. Causes and Cure of Chronic Disease is available. Reversing Depression Naturally is available. Sex is Sweet, enjoy it. And of course, this advert you are seeing on real estate, on this estate, Splendor Gardens, our sister company is the one developing it. If you are interested, give me a call, and then we'll know how you can possess a property there. Right now, we are selling lands. We've not started building. So if you want to buy into the land, you let us know. Thank you so very much for watching. Do not fail to reach us, even if it's with just some good reports. If you are watching also and you don't even have any question, just send me an SMS saying, I watched the program on diabetic foot ulcer today, and then I will add you to our list where we usually reach people. Thank you so very much. God bless you. Till I come your way again. Bye-bye. God bless you. Bye.
Welcome to Splendor Gardens, Mowe, Ogun State. A serviced estate, fenced and gated, with paved roads and streets, 24-hour surveillance and security, and standard recreational facilities. Our strategically planned lots are for all classes of people, from the upper class to the young and upwardly mobile. Available lot sizes are 160 square meters, 220 square meters, 300 square meters, and 600 square meters. For more inquiries, please visit our website www.visglotterproperties.com or call those numbers on the screen. At Splendor Gardens, quality bingos with affordability, beauty, and serenity.